Hit it.
And welcome to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
All right, here we go. What you think about, you will bring about.
Well, hi, everyone, and welcome to Alzheimer Speaks Radio. I'm thrilled you could join us here today. We're going to have an interesting conversation about end-of-life care and connecting to the best providers for your needs. But before I introduce you to our guest today, I always like to do a little bit of housekeeping. So for those of you that are new, Alzheimer Speaks is about sound information, not just sound bites. We like to have real conversations with real people in the trenches. And, this all started because my own mother lived with dementia for 30 years. And I just thought, gosh, there's got to be more resources and tools out there for me to tap into. I also want to thank the Mark Arneson Band. They do our opening music called Clarion Call, and you can download that on any of your favorite music platforms. I also want to give a shout out to Artist Senior Living of Potomac. Today, actually this evening, you can participate if you'd like in a caregiver survival camp that I'm putting on, finding out about the realities of dementia-friendly, family tips and tools. That'll be at 6 p.m. Eastern Time, and you can sign up for that by calling 241-293 0155. And then on Thursday, they're also going to sponsor another program. This is Tools for Dementia Professionals, Understanding and Supporting the Families We Serve. And that one will start at 5:30 Eastern Time, go till 7. And you can call 240-293-0244 for information on that. And then with COVID, I know everyone's feeling isolated. I do want to mention two groups that I facilitate conversations with. One is sponsored by Arthur's Senior Care. It's called Arthur's Memory Cafe, so it's for people with dementia and their care partners. We get together the second and the fourth Wednesday of each month, and that starts at 2 p.m. Eastern. That would be 1 Central. 12 Mountain Time, and 11 a.m. Pacific Time. Again, on the second and the fourth Wednesdays of the month, you can reach out to me at radio@Alzheimer Speaks, and I can get you the Zoom link for that. And then, Brookdale North Oaks, along with the Shoreview Parks and Rec Center, sponsor a in-person program for caregivers. It's our Caregiver Connect. And we meet the last Wednesday of each month in Shoreview, Minnesota, at the community center from 10 to 11 a.m. Now, last month we actually did a virtual, and I'm not sure what will happen this month in January because of COVID, so we'll just play it by ear. But you can call 763-913-6140 for more information on that program. Let me see. I've got a few others here. Dementia Map, of course, I have to mention. We've got about 150 categories you can search. It's wonderful for families and professionals alike to find resources, products, and tools and services that can support you on your personal journey or as a professional. And then Picnic Health has an important research project they're working on for Alzheimer's disease. And you can go to picnichealth.com/speaks and sign up. And when you do that, you'll get $25. Picnic Health, what they actually do is they collect and they digitize all of your medical records into one account. And then you can consent to share anonymized data from your record with medical researchers. And by them examining that real world data from your personal records, researchers can find answers that might not have been found in clinical trials. So if that is something you're interested in, again, go to picnichealth.com/speaks. And if you want to register your loved one with dementia, you can do that as well. Last one I want to mention is there's an opportunity for libraries to get a $2,500 grant for either starting or expanding services to serve people living with dementia. And we have many dementia-friendly communities out there and many dementia-friendly libraries. So if you're interested in information on that, just reach out to me again at radio@Alzheimer Speaks. That will be the easiest route because the URL is fairly lengthy. We're going to hear from the Footbar Walker, and then we are going to be right back with our guest, Ben Darr.
I'm Peggy from Danville, Kentucky, and I'm 91 years old. The Footbar Walker revolutionized my care of George. It absolutely benefits the patient and the caregiver both, and that's the beauty of it. It's so easy to use. It folds up just like a dream. I got it in and out of the car without any effort at all. The saving that I made from having to put him in a nursing home came to about $192,000.
The Footbar Walker was designed not only to assist the patient, but also the caregiver. It's like having a portable pull bar everywhere you go. Patients have more control of their motion and pain management, and no lifting from the caregiver is required. Caregivers, put your foot down and quit hurting your own health, no matter which side of the Footbar Walker you're on. It's a win-win. Call 731-924-4444 and visit our factory showroom in Paris, Tennessee, or visit us online at thefootbarwalker.com.
Well, I'm thrilled to be back with you, and I can't wait to introduce you to our guest today. We are going to be talking with Ben Darr, and he is the co-founder of end-of-life care platform for caregivers. And, you know, he's all about connecting people with the best providers for their needs. And so I just want to welcome you, Ben. I'm thrilled to have you with us. We're going to be talking about your company, Open Caregiving. And so welcome. I'm thrilled to have you here on this Tuesday afternoon.
Thanks for having me, Lori, and thank you for your many years of dedication helping people caring for and living with dementia.
Well, when it hits your own family, it hits you hard. And you realize the pluses and the minuses in the industry that's serving you. And so I just felt like I had to step in and see what I could do to improve things for other families. Now, Ben, before I get to asking you the questions that I've designed for this program, I always like to ask people if they have been personally touched by dementia in their own family or circle of friends.
Yeah, well, actually, somewhat recently, my grandmother, who's actually in Israel, she was diagnosed with dementia, and it's been difficult, especially during the pandemic, not being able to go there and see her, especially hearing from some of my family there that it is starting to progress a little faster. So definitely hoping to get there soon so I can see her. But yeah, that was a more recent development.
Okay, wonderful. Well, thanks for sharing that. I want to ask, what made you step into this space and what helped you decide to kind of dedicate your time into helping people, navigate end-of-life care?
Yeah, well, thank you for asking. So over the last few years, both my grandmother and my aunt entered their end-of-life stages, and it was a really difficult time for my family, and I started to get really frustrated just being so uneducated about end-of-life care and caregiving and trying to help but not being super helpful. And that kind of gave me the realization that this is the first time of probably many times where I'll either have to be a caregiver or a care recipient, and those will be some of the most meaningful moments of my life. And I wanted to use my technology background to help just make those moments easier for myself, my family, and for every other caregiver that and care recipient that will inevitably get to that point. So it was really that realization that this isn't a one-time thing, and that it is a really, really impactful moment or period of your life.
Mm-hmm. How would you define end-of-life care? Because, some people think, okay, they've got hours, and other people are thinking, well, it's coming,
Yeah.
and it might be a few years out. Can you define that for our listeners?
Yeah, it's a great question. So I think it's changing a little bit. If you asked someone, 5 or 10 years ago, I think they would say the last few months of someone's life. But with palliative care growing and becoming more affordable for certain demographics, it's now turning to more of a multi-year approach to the final years of someone's life, and making those as comfortable and according to their wishes as possible. So I personally look at it as, not just the last weeks or months of someone's life, but, the time leading up to hospice care. So hopefully in some sort of palliative care, and then hopefully hospice care is not a last minute decision in the last weeks of life, but more of a, transitional phase and a period for them to, find meaning, and for the family to find spiritual meaning, and really kind of settle into what's happening versus it being a rushed experience.
Mm-hmm. I should have you define hospice and palliative care for our audience, because I think a lot of people are familiar with hospice and they think palliative is hospice, but there is a difference. And so why don't we kind of clear that up before we dive in deeper?
Yeah. So it's changing in real time. Currently, most people who are on hospice care can't receive curative treatment. So hospice care is really meant to improve quality of life and to make sure that the care recipient is comfortable in their final months. Palliative care also has that approach of emphasizing quality of life and comfort, but you can, depending on where you are in someone's condition, you can also receive curative care. Now that is starting to change a little, and the lines are being blended because some people are nervous to go on hospice care if they can't, if they're not allowed to try a experimental treatment, or if they just don't want to commit to not trying any other cure. The unfortunate misconception around that is that you can, go off hospice care at any point. So choosing hospice care is not a one-time decision that you can't turn around on. But in order to increase, utilization of hospice care, there's starting to be some changes in the way Medicare is talking about it and providers are talking about it, to make it more of a continuum of care from palliative to hospice care, and kind of blend the lines a little more so more people have access to it. But currently under hospice care, you can't really enroll in any sort of curative treatment.
So when you're talking curative treatment, does that mean even like an antibiotic, not necessarily like chemo and radiation?
No, you can. It's curative to like the primary diagnosis of the care recipient. So it would be things like chemo or radiation.
Okay. It's just good for people to understand, the vast, applications that are out there. And again, this is ever changing. And I know one thing that I found was different doctors have different perspectives on both of these, and if they will refer or not. Have you seen that be an issue too, where some doctors are more comfortable than not making a referral?
Yeah, definitely. And there's different education levels around hospice care among physicians. Unfortunately, it's often not required in their training to have a deep understanding of hospice care. So it definitely varies widely, the point at which physicians recommend hospice. And that's something we're trying to do at Open Caregiving, is try and help educate both caregivers and care recipients, as well as physicians and people who can help influence caregivers to make decisions that are most in line with the wishes of the people they care for.
Okay. Well, why don't you tell us about Open Caregiving, and I always like to ask people how they pick their title of their company and, their name, and then how does it work?
Yeah. So the question about the name, my co-founder, Dan, he actually came up with it really just at the genesis of starting it. We wanted all the information and resources and quality scores to be open to everyone and be transparent and accessible. So that was kind of the genesis, and we just stuck with it. Open is the term that we both open anything. So from a technology point of view, open source means like technology that is open to the public and people can build on top of it. It's just a term that has permeated different parts of our lives, and we wanted to bring it into Open Caregiving since it's such a collaborative effort. And then what we do is, and this is a growing list of things that we do, but at the core is like resources for end-of-life care. So everything that you would need to know about hospice care, what it is, when to consider it, how to have, these end-of-life conversations, preparation once you and your loved one decide that it's time for hospice care, and then information also revolving around grief and bereavement. So we have this whole guide to hospice with these different chapters, and then in addition to that, we have a full caregiving glossary that jumps into different aspects of caregiving, from home and community-based services to different aspects of Medicare or Medicaid that people often get confused about. So all those types of things. So that's kind of our resources and education part of the site. And then we have another core part of the site, which is a hospice search platform. And the thought behind this was that when you search for a hospice provider on the internet, you often don't get results that help you make a smarter decision. Sometimes you'll see Google reviews or Yelp reviews, but these are often, people who had an extreme experience, either good or bad, and not always the most trustworthy. So what we decided to do was take the available information that Medicare publishes on quality scores and make those super accessible to caregivers that are searching for the best provider for the person that they're caring for. So we make that data very easy to understand, and we make it so if your priority is making sure you choose a provider that excels in spiritual care and religious care, and also, for example, giving timely help, we show you which providers excel in those categories, and which providers, excel in other categories, or who excels in all those categories. So we try and make it as simple as possible to pick the best provider for what you're looking for.
Okay. Well, and it is confusing, and it is complicated because so many families don't have this conversation until it's too late, and then they're kind of second guessing, is this what mom or dad would want, or, my spouse, because we never really, we really avoided the topic, I guess is probably the best way to put it. And then there's all that added guilt of, am I doing the right thing? And, am I really meeting their wishes, when you never had those conversations? So I like that you've got the educational resources there where people can kind of search. Do you have anything that helps them have a conversation about this topic so the patient can be involved?
Yeah. So I am just pulling up the name. So on our How to Have End-of-Life Conversations guide, we talk a lot about, how to have the conversation, and then we also link to the Conversation Project, which does a phenomenal job, going even deeper on how to have a conversation from many different angles. So we didn't want to. They've done such a good job that we didn't want to try and rewrite what they've done. So we have a lot of information, and then we link to them for really tactical ways to start the conversation and how to respond to certain disagreements or confusion and that type of stuff.
Okay. There's and I don't know if you've heard of Compassion and Choices, but they have a great program, and especially dementia related, where they help you with your healthcare directives in terms of, if this happens, do I want that? If I want that, what if this and that happens? What are your priorities? And I know for myself, I haven't been diagnosed with dementia, but Lord only knows, my mom lived with it for 30 years. I could have it, but I went in and I filled that out because it's like, and it could apply to heart attack, car accidents, all kinds of situations. But just to be able to have, let your loved ones know what you want. These conversations are deep in many, and there is such a stigma about palliative care and hospice, and people thinking either that they can't afford it or they're not ready yet, and they don't understand the umbrella support, that it's not just for the person who's sick, but they really help the family and those caring for that person as well, wouldn't you say?
Yeah, I completely agree. And to your point about having the conversations, it's the same thing. It's really important not only for the care recipient, but also for the caregivers. It's one of the most difficult positions to be in, not knowing if you're making the right decision for someone. So the best thing you could do for them is share your priorities and preferences beforehand, and it makes that experience a lot better, and it makes a caregiver feel good to know that they're following what you wanted. And then to your point about misconceptions about hospice care, it's one of the things we spend the most time doing, trying to educate everyone within healthcare on the provider side and caregivers and care recipients, that hospice is not a place you go to die. It's a place where you go to find comfort, and comfort for everyone involved, the family, the care recipient, friends, and people who enter hospice care earlier rather than later often are so happy that they entered it earlier, and were able to have that transition in life to and not have it be rushed. It's really unfortunate that there's still a lot of misconceptions, and I think that's kind of why the lines between hospice and palliative care are starting to blend, because people are realizing that it can't be so. One of the ways to educate people is to make it less of a rigid thing,
Well, one of the things that I guess kind of irritates me with the conversation is, we talk about end of life, and I get that, but it's really about quality of life and comfort of care at that end of life. And those are the two important factors that I think people are missing. I remember, both my parents were on hospice when they died, and I was shocked, like when they're like, oh, well, we'll get a liquid medication because they can't take a pill anymore. And I'm like, well, why the heck didn't anyone say that earlier? We had to get to this point and struggle with her medications because she's having difficulty swallowing, when this is common, accessible, medication adjustment. And yet, when you're dealing with those professionals, they have such great insight. I think they're much more in tune to pain levels and signs of such. And, who wants to be in pain? Who wants to be uncomfortable? bringing in joy, really having staff that are compassionate too, I think can add such quality of life in and of itself when they still are treating you like a human being and not just some task that they have to do, and being able to support families there. What has really surprised you about hospice and palliative care now that you're, full in on this field?
Yeah, a few things. I think the first, working with a lot of hospice providers, it's been amazing to see how the industry really attracts people that genuinely want to see things improve for the people in their end of life stages. Kind of like you were saying, it's people are just so collaborative and willing to try anything to improve this period of people's lives. So that's been really refreshing. You don't see that in every part of healthcare. And I think one other part of that is seeing that hospice care is really tailored to the preferences of the care recipient and the family, more so than I think other types of care. And I think that's so important because caregiving trajectories and patient trajectories are as diverse as the people involved, and are really shaped by family relationships, cultural norms, expectations, socioeconomic status, and it's been amazing to see how hospice providers across the board really take everything into consideration, and don't just treat everyone in a one-size-fits-all manner. It's been just really eye-opening, and I think a lot of other parts of healthcare could learn from that.
Oh, I totally agree. It's like they're a different breed out there. And typically what I have witnessed too is the calmness that they bring to a family that's under just such grief and duress and stress. And they get all the family dynamics. So, I mean, if you're having a feud within the family, there's nothing they haven't seen and can help you deal with. And just to tell you, you're not alone in that situation makes a difference to so many people. Or being able to be there for the person when a family member is just unable to because they're grieving so much. It's pretty amazing. They also, I think their follow-up is incredible as well. Even after somebody passes, they don't. It's like their job's not done. They're still checking on you for a year. I think a lot of them it's 13 months. They go that 1 month over, and people are shocked, but they're honored to be remembered. And I've seen providers starting to get very creative with figuring out the best ways to support families in those grieving period after their loved one passes. I've seen providers just trying new things, trying to embrace technology and community, especially during COVID, when it's been difficult to get together. So I completely agree. It's a really big part of the equation that people sometimes forget about. Yeah, I would actually like to see them incorporate something that we've done for dementia. When someone has passed, we created a caregiver re-entry program because so many people are so lost because their whole world has just been focused on caring for someone else. And once that person's gone, they don't know who they are anymore. A lot of times they've lost connections to their own friends and families, and time has passed. I remember one woman going, gosh, I'm gone shopping. Everything in my closet's out of date, and I can't even shop because I don't know what's in.
Wow.
It was just, I think, helping people know that that they're not alone. And the grief groups are fine, but usually those are, 8 weeks, and then you're kind of kicked to the curb again. And that's what I hear from families is just like, it was helpful, but it didn't connect me to my community. And I think that's one of the things that people are looking for there. What have been some of the most impactful memories for you in starting Open Caregiving?
Yeah, so I would say probably the most impactful has been, I started Open Caregiving with actually two of my friends, Dan and David. I started working on it in the summer of 2020, so about a little over 18 months ago. And then last summer, the summer of 2021, one of my best friends is actually battling a rare autoimmune liver disease that progressed to the point of him needing a liver transplant. And so after spending a year working with countless caregivers, I was very aware of the physical and emotional suffering that individuals with a serious chronic condition and their families experience when the condition quickly progresses. So while he needed a liver transplant, he went on the transplant waiting list, but the probability of someone living a full and healthy life is higher if they get a liver faster. So I actually, this past summer, I actually volunteered to donate half of my liver to my best friend, and it was quite the experience from many points of view. I was obviously extremely grateful to have had the opportunity to help my best friend, but also really thankful for the sense of empathy I developed during the recovery process. And I really gained this humbling perspective of having to rely on others for activities of daily living, and witnessed like the firsthand effort it takes to be a caregiver from the care recipient point of view. And that added so much more meaning to, just my everyday work, having really gone through some of it. And obviously I was fortunate enough to, after a few months, kind of be back to myself again and be able to do everything. But those first few weeks, especially where I was pretty reliant on my girlfriend and my parents and my sister for everything, was quite an experience for the work that I'm doing, and really connected me closer to why it's so important that we help caregivers.
Yeah, it's like you said, it puts you in a whole different light in terms of what somebody is going through. It's really easy a lot of times for us to want to help and give care, but most of us don't like being cared for, because and not that we don't want to be cared for, but we don't like being sick where we lose our independence, and so there's this pushback of I can do it myself, and all of those things that come into play that emotionally you have to grapple with and work your way through them. And again, that's something we don't really talk a whole heck of a lot about. It's kind of that ignorance is bliss. It's not going to happen to me or my family. A lot of us try to go into that mode. And,
completely.
And that doesn't. That's not honest.
And all, like you said, all of those nuances that you don't realize until you're actually in the experience was really eye-opening for me. There's, even after going through the experience, the number one thing I learned is that I still don't really know what it's like for someone else, because every experience is so different. And that's a very humbling thing to realize, that you really need to listen to every single person. No matter how much you do know, you don't know what they're going through. So it was probably the most memorable experience so far, just in terms of, obviously for my personal just personally, but also just for the work that we're doing and, adding another level of meaning to why it's so important.
Mm-hmm. Well, and I think that is important. You acknowledge that everybody's journey is different. And so often we don't like things that complicated. It's just like we want one story so that we can wrap our heads around it and we can control it and fix it. And, that's not life. We're all individuals, and no matter what you're going through, no matter what disease or illness you might have, it's going to crop up different because all of our bodies are different, our immune systems are different, our environments are different, our network around us is different. And so it's going to ebb and flow. And it is, any illness, I believe, is bigger than just the person. It affects everybody around them as well. And so to have these difficult conversations that I really don't think have to be difficult, but there's for whatever reason, we have this huge stigma about death and dying, and yet anyone you ask says, yeah, I know I'm not going to live forever. So I kind of shake my head and go, why has this been so difficult to have this conversation when we all know realistically, we're not getting out of this place alive. So why don't we want to plan? We're so obsessed in this life with control. Why don't we want to control how we exit? I still haven't been able to figure that one out because I guess I'm just one that's not afraid of that conversation, and I talk about it openly, even when people are uncomfortable. Even like with my daughter, I said, no, I want to be cremated, and she's like, I don't want to burn you, and it's like, honey, let me be small once in my life. It's okay. I don't want to take up space. We talk about all of care, but it's just, it alleviates so much for those who are caring for you if you can be on the same page with, yes, I want to pull palliative care in because I know not only are they going to support me, but they're going to help support you. And give you some time back as well. Same with hospice care. This is a journey together, and yet I think so many people don't look at it like that. But it really, in my view, it's a caring journey together. Would you agree or disagree with that?
No, I completely agree with all of it, and I think back to the point we discussed earlier about quality of life, I think having these discussions earlier, even before, anyone is sick or anyone is a caregiver, increases everyone's quality of life. I've heard from a bunch of people that by having the conversation really early, they felt a weight lifted off their shoulders that they didn't even know existed, both on the caregiver and the future care recipient point of view. And so I think it is weighing on a lot of people without them realizing. And then obviously when you actually have to make decisions, then it's weighing on you like crazy. So I think education around why the conversations are important and how they can lead to not only your preferences being fulfilled, but also, your quality of life being better in the time you have now can really drive the conversation because, everyone wants better quality of life in the present, right? So I think it's really an education puzzle of figuring out how to best approach people in a way that they're open to listening, and then what is the best way to talk about these subjects that people don't necessarily want to focus a lot of attention on any given random day.
Well, and I think about too, so many people are divorced or have never been married, they live alone, and they really worry about who is going to be my team. Who's going to care for me? And so creating that care team, which, maybe it's not family, maybe you're estranged from your family, maybe it's your neighbors, maybe it's your friends, maybe it's coworkers. maybe there really isn't anybody that you feel comfortable with. You still should think about having someone be that power of attorney and able to make your healthcare choices for you. And maybe that's hiring somebody out if that's what you need to do, in that case. But ignoring it's not going to make it any better. And so I just really think these conversations are so important. Now, on your website here, if people, go to opencaregiving.com, right away you're going to pop up. They've got great information on advanced directives, Medicare, Medicaid, because financing is a big piece of this puzzle. I know that. Home health care, hospice, caregiver therapy, caregiver support groups, respite care, and there you have even more guides as you go into this, like what the heck is acute care? What's an adult day? You've got a whole glossary of terms for people to sort through, and I'm a big believer in glossaries because you don't know what you don't know until you don't know it.
I think and that's actually how we met, through your Dementia map glossary.
Yep. So, it's just, it's so important that we can't have enough resources to help people find their way. I love this. You've got a section for caregiving stories from your community, finding intimacy and meeting in the end of life. Don't push that away. That's precious. There's still ways to do things, and to be able to choose happiness despite circumstances, helping families through grief. You've got tons of great stories here, as well as, putting in your zip code to find your best hospice needs, in your area for people. Again, I give you kudos for pulling this all together. How long did it take you to build the website and fill all of the information in?
Well, I appreciate the kudos. It's inspiring to see the work that people like you've done over the last decade, and it definitely influences kind of our approach to serving caregivers and care recipients. So I appreciate that from you. It's taken us, we do everything one piece at a time. So first we built the caregiving glossary, then we worked on the caregiver's guide to hospice. All along that path, we were interviewing caregivers and having them share their stories, both to share with our community, but also to help inform us on things we may have overlooked or just didn't understand. And then more recently, we built the search tool, started working with some of Medicare's quality data to incorporate that. So, all in all, it's been about 18 months so far, but, we built one thing at a time, launched it, got feedback, and understood what caregivers wanted help with next, and kind of went there. So everything's been driven by what we hear people need the most help with. And that's kind of what's driving our future steps as well.
Well, fantastic. And like Ben said, they are part of Dementia Map, or you can go right to, opencaregiving, to get more information from them directly. Where do you see the biggest areas of improvement in end-of-life care, or maybe needs in end-of-life care as well?
Yeah, I think it's a tough question. There are a lot of areas that are, there's a lot of great stuff happening, but there's always an area for improvement, especially when you're talking about such a serious subject. I always gravitate towards two things. One is better feedback loop between caregivers, care recipients, and providers. Currently, that feedback loop is quite slow, and it's mostly done through Medicare's surveys, which is they're continuously improving them, and they are doing a good job. but I don't think it should be the only channel of feedback. Because at the end of the day, that's how providers are going to improve, by understanding what they're doing well, where they can improve, and that feedback comes in many different ways. And rigid quality scores aren't the only way I think providers can get better. So that's one thing we're thinking about at Open Caregiving. How can we help facilitate that feedback loop? Another area I think, just from my personal experience and from hearing from others, is education among younger generations that are increasingly filling the primary caregiver role. Education around hospice and palliative care. A lot of people in their 20s don't even know what hospice care is, let alone like when they should think about it, or why it's helpful to know about some of these things before you actually need them. So, and I also think it helps with those conversations, being introduced to the concept of hospice care and why it's important. It naturally flows into, then we need to have these conversations before, we ever get close to that stage. So I think figuring out how to educate younger generations, especially as the baby boomer generation starts to age, is really important, and something that needs to start now, before baby boomers enter their 80s. So that's something else we're thinking about, and it's a lot more difficult than just saying, let's educate millennials. It's there's a lot of strategy and complexity to it.
Yep, for sure. And like you said, there's always areas that we can improve on. I think even one of the ways in terms of how we give feedback, everyone's doing the surveys and stuff, but so many people miss being able to talk to somebody. I think you can pick up a lot on a conversation, and yet I'm the first to admit, if I don't know your number, I don't answer it. Because scam calls and stuff. So there's just there's so many different hoops that we all have to, I guess, jump around and figure out better ways. But one of the best ways is for consumers to speak up and let it be known, the good, the bad, the ugly. That's how we protect what's working, and that's how we become fluid to make changes to better serve. And if you have a complaint, give some ideas on how to improve it too. I mean, you're the end, you're the receiver. So how would you like to be treated? What options would you like to have? That information is just as important, if not even more so, than speaking up that something's not working, because that gets us closer, to making change there. Anything that we've missed that you want to cover? I just, like I said, I love the work that you're doing. I think this is a really important topic, and I wish more people would be less afraid and really educate themselves, because even if you don't need it, somebody is going to need this information. And the more resourceful we can be for each other, the easier it is to stay in community and build our community and give one another comfort with that.
Yeah.
So.
Yeah, I completely agree. No, I think we covered everything. Everything. The only thing I would say is that, educating yourself on these topics and having those difficult discussions, much earlier than you need to, really makes, life richer in the moment. And it, some people say to me, like, isn't it really difficult to, spend a lot of time working with hospice providers and caregivers? And I always say to them that it makes, there's so much amazing stuff that happens at the end of life, and so many amazing people that devote all of their time and energy and put the people in front of their own needs, and it really makes like every day richer. even if you're not personally in an end of life stage. So I would just tell people that don't be afraid to educate yourself and have these discussions and share that advice with everyone you know.
Exactly. I'm going to give a plug for a company. I want to say they're over in Australia or the UK. I think it's Australia. But she has put together, it can be an app or it can be cards, and it's called Your Life Wishes and Your Life Story. But it really guides family and friends to have deep conversations, and they're not one-sided. So, if I ask you, Ben, how would you like to be cared for at the end, I'm expected to say how I'd like to be cared for too. So it's a natural conversation instead of, oh my gosh, we're in crisis, answer this, I have to write it down, type thing. Because I think sometimes that's how it's approached. And then there's just this angst wrapped around it instead of having conversations and learning from one another different options that might be available, to us with that. Now, people can get a hold of you by going to your website at opencaregiving.com. That's opencaregiving.com. Or you can email Ben at hello@opencaregiving.com. Again, that's hello@opencaregiving.com. You are also on Facebook. So if you, love Facebook, just put in the search bar Open Caregiving. And same with LinkedIn. You can search under Open Caregiving as well. And, check out their site. They've got lots of great information and tools, to be able to use. And if you're a provider, hook up with them and see how they can help you get better seen as well, with all of this. And, have it in one spot. I'm thrilled that Open Caregiving is part of Dementia Map as well. So, thank you for sharing your knowledge and your services, with our group, because again, I don't think any of us can do this alone. I think it takes a team to provide quality of life, and there's so many issues to be addressed. Nobody can answer them all. So you guys really kind of dove deep in this area, and it definitely is a need. So kudos to you.
Thank you, Lori, and thanks for having me on the show. And I'm looking forward to continuing to see all the amazing work that you do as well.
Wonderful. Well, for our listeners, if you like the show, click it, share it. That's one of my things is, don't keep good information to yourself, because there's always somebody else who needs it as well. And again, they might not look like they need it, but we don't have these conversations, so you don't really know who's mulling around stuff and what their caring situation is within their family and circle of friends. So just, start being more authentic. Open up the door so it's easier for people to grab this information. You can change the world by just doing that. So until next time, take care, everyone. Next show on Thursday, we're going to be talking with an attorney, Margaret Barrett from Safe Harbor Law, and we're going to kind of be going down this path too about end of life, but just in a different area in terms of protecting your assets. So thank you all, and feel free to subscribe to the show. Bye now.
Hi, everyone. This is Meredith from the Senior Fitness with Meredith podcast, where I discuss all things for seniors, from fitness, your health and wellness journeys, how to be all over strong and beyond. I also have my mini podcast called Motivation with Meredith. It's a great, quick motivational pick-me-up for your days. Join me, listen now, search for Senior Fitness with Meredith on your favorite podcast platform.